All around our world today, there seems to be more and more uses of radiation. But many people fear the constant usage of radiation because of how harmful high amounts of radiation are to people. However, people need not to fear radiation, but instead embrace the possibilities that it offers. It can further analyze the human body and prevent or cure diseases. The problem with using nuclear materials in the medical field is that many radioactive materials decay quickly, making it difficult to transfer them to the hospitals where it is needed. This is why Pearland needs to further invest in its nuclear infrastructure because of how close it is located to the medical center in Houston. PET, or position emission tomography scans, use small amounts of radioactive materials called radiotracers to evaluate tissue and organ functions. Radiotracers evaluate the organs by emitting radioactive transmissions that can be spotted using a special camera. The PET scan can be used to check blood flow, oxygen use, and sugar metabolism. The PET scan can find early traces of diseases that would be too sensitive for other equipment to find. There is very little pain involved in the scan, making it ideal for people who have very low pain tolerances. Nuclear medicine would also be cheaper than using a conventional surgery method to detect diseases. Another way to use X-rays is in the computed tomography scans. These are full-body scans that are formed by combining multiple X-ray images that are taken from different angles. The resulting image is tomographic, which means there are cross-sectional slices of the scanned object. This allows doctors to see inside of the patient without any surgery. These scans can be very important when dealing with parts of the body that cannot easily be cut into, such as the brain or the heart. These scans would not be possible without the use of nuclear in the medical field because X-ray machines require radiation to function. While scientists are still discovering more about the long-term effects of radiation medicine on people, there seem to be no immediate consequences of radioactive medicine. Another type of scan used in the medical field is the X-ray. An X-ray machine works by emitting tiny particles called photons through the body. These photons then show up differently on the X-ray film, depending on what substance they move through. If the photon moves through the air, then it shows up as black on the X-ray film because of how easy it is to move through the air. When the photon penetrates a liquid, it shows up as gray because the photon can only partially penetrate a liquid. A photon cannot penetrate very dense matter, such as bones, and these substances appear white on the X-ray film. This distinction allows for a very clear and precise image of more complex and intrusive systems in the body. It can be used to diagnose broken bones or joint damage. The process of using an X-ray machine is also very quick, making it ideal for situations where speed is critical, such as in an emergency room. While the kind of radiation you are exposed to is the same as that from the sun, there can be some potential damage from these ionizing rays that the sun can't do to you. An X-ray may cause you to become infertile or can potentially cause birth defects in unborn children. While extremely unlikely, there are some cases where X-rays lead to cancer in patients. This risk does not outweigh the benefits that these X-ray machines provide society. Radiation therapy is a very common way to treat cancer. This form of treatment uses radiation, usually X-rays and gamma rays, to kill cancer cells and shrink tumors. Although radiation therapy is often used in conjunction with other forms of cancer treatment, it is still very important to the cancer treating process. There would be a great loss of life if nuclear was not invested in the medical field to further battle with cancer. Let's quickly recap everything that we have discussed here today. PET scans inject radio tracers into the bloodstream that can then be checked with a special camera. They have the benefit of being cheaper and less painful than conventional surgery. There are no short-term consequences for the process, and long-term effects are still being discovered. X-rays use photons to capture images of complex systems. The photons show up differently depending on what type of matter they travel through. The CT scan can then process multiple X-rays to show systems that are too sensitive to perform surgery on, such as the heart or brain. Nuclear power is not something that we should fear. The science needs freedom to be discovered and explored, but instead, people weigh it down and deny it from ever seeing this freedom. Nuclear is the solution to majority of the world's problems. A good place to start in nuclear research is with nuclear medicine. That's why we think developing a nuclear program now would help to get ahead of the other countries before it's too late.